Many parents are still divided over a new vaccine that can provide protection against human papillomavirus, or HPV. HPV is a very common sexually transmitted disease that is linked to cervical cancer. This controversial subject is the topic of our regular Smart Medicine segment, focusing on healthcare issues from a female perspective. It's called Her Baptist. And this month, Lorene Cachola has some helpful information for parents sorting through this tough topic.
As an OBGYN, Dr. Laura Bishop says she talks to her patients every day about HPV.
And there are many different types of HPV. They've actually identified over 100. About half of them affect the genital area. And of those, about half affect the cervix and half affect the outside of the vaginal area, causing genital warts.
According to a report in the Journal of the American Medical Association, almost half of all women between the ages of 20 and 24 are infected. More than 20 million Americans have HPV. For many, it is harmless, producing no symptoms. But for 3,700 women each year, it is a death sentence. They die from cervical cancer caused by HPV.
Over 99% of cervical cancers are caused by HPV. About 99.7% are caused from HPV virus. Unfortunately, condoms do not do a great job of preventing against HPV because many times this virus is on the outside of the genital area where the condom may not protect against the skin-on-skin contact. So it still can be transmitted even with use of condoms.
A new vaccine called Gardasil guards against certain strains of the virus that cause 70% of cervical cancers. Recently, the FDA approved the vaccine for use by girls as young as 9 because it's more effective at a younger age, before girls become sexually active. Many parents, like Martha Flowers, are eager to get the vaccine for their daughters.
I just feel like at this point in time, with all that goes on with teenagers in the world today, that it's a very essential part, just like any other immunization, any booster you get when they're babies. This will be another protective device for them as they grow older.
They've done studies looking at people getting the HPV vaccine early in life, and that can lead to a decrease in cervical cancer of 75%, versus if people wait until they're a later teenager at 18 or so, that may only decrease their chance of getting cancer by about 40 to 50%. Just because by that time many people have become sexually active and already picked up one of these viruses.
A recent study shows that 7% of kids under 13 have had sex. By age 15, that number jumps to 25%. Critics worry that the vaccine would lead to young girls having more sex or becoming sexually active sooner. Dr. Bishop still advises abstinence to her patients who get the vaccine.
The safest thing for a young adolescent girl or a teenager, anyone in fact, is to remain abstinent, ideally as long as possible, most ideal being until they get married. But I tell mothers and I tell the teenagers too, even if they remain abstinent all the way until marriage, men can harbor this virus for a very long time, not have any symptoms, so they basically can be carrying it around with them, and if they ever marry anybody who's ever been sexually active before, they can get the virus from them, even if they remain abstinent.
And women who get the vaccine should still get an annual pap smear, because an abnormal pap smear is usually the first sign that something is wrong.
Even in women who do get the vaccine, this prevents against the most common types of cervical cancer, against the most common types of the HPV virus, but there are other types of the virus that it is not effective against, and so women still need to come in for their annual pap smears.
But for now, Dr. Bishop says that the HPV vaccine is one of the best ways to protect women from cervical cancer. For Smart Medicine, I'm Lorene Cachola.